Very good.
Hello, everyone, and welcome to the Healing Our Children 2018 World Summit. I'm Alison Morris from Full Potential Parenting, and I want to welcome you to another interview. I'm really pleased today to have several guests, actually. I have Stanley Rosenberg, who we're going to be talking with about, among other things, his new book, Accessing the Healing Power of the Vagus Nerve, which is very exciting. I recommend this to everyone. But before we get into that work, we're going to chat a little bit with Piia Pannbacker, who is the mother of a child whom Stanley had worked with for about 5 years. And so she's willing to talk. I'm sorry, Stanley?
5 years ago. I only worked with him 2 or 3 times.
Oh, okay. I'm sorry. So clarify that. And so Pia is going to clarify everything and tell us a little bit about her son, Wilhelm, and what he was diagnosed with autism. At what age, Pia, was he diagnosed?
He was 6.
Okay, 6.
Yes. Yeah.
And what sorts of behaviors was he exhibiting at that time? What was he like?
He was a very not functioning young guy who was very expressive in biting and hitting and not communicating. He was stammering. He couldn't really speak. He had difficulties in speaking, and he didn't function. You could clear. It was very clear. Yeah.
Okay, so at one point you heard about Stanley's clinic.
Exactly. Yeah.
Right, and this is in Copenhagen.
Exactly. I tried a lot of different stuff because I have the meaning that you can do something about everything. There's a reason why people are acting like they are. Or, of course, it's not everything, but I had the feeling that with this boy we could move something because he had been in 4 narcoses in 1 year, and that tricked this autism, is our opinion. We don't know. But that's what we saw. He changed after the diagnosis, after the narcosis. And then he got the diagnosis, and we tried, many things. Eyes, we tried to do, exercises for the eyes. We've been giving him omega fish oil, vitamins, you can call it. And we did a lot of different stuff with the food. We took out gluten of his food, and for everything you could feel a little bit, but we didn't make a breakthrough. It still wasn't the boy that we knew were in there somewhere. And then we found Stanley's clinic, and I actually wrote to Stanley, and he replied, "Yeah, please come and see me. I have a lot of experience with autism." And he made him clear in 20 minutes. I wouldn't believe it if I hadn't seen it by myself. But it took Stanley 20 minutes to change this boy. When we came, it was a normal Wilhelm with autism. And after 20 minutes, he didn't stammer anymore. Am I saying it right when you speak? My English is maybe not that good.
No, that's fine. So he was stuttering?
Stuttering, sorry.
Okay.
Yeah. He was stuttering. And when after the 20 minutes, he was getting up off the bed, and he was speaking clearly. And he was clear in his eyes, and everything was clear. And when we drove home, he was singing and talking the whole way. He had never been talking or singing ever. I didn't believe that it was my boy I took home.
How many years had he been living with the autism by the time you took him to see Stanley?
Well, actually, since his birth, I guess.
Really? Okay.
But what made it really bad was the 4 narcoses he was in.
Okay.
So that really makes a change.
That might be a world record, Stanley. 20 minutes.
Yeah.
That's not too bad.
Yeah.
What were you able to do for him? What did you see when you examined him?
Well, I saw the symptoms that Pia described. There was some violent behavior, and he was not using language. So that was enough for me to say, what can I do? I have sort of a protocol, and the first thing was working at the back of the neck to try to relax the small muscles and to improve the blood flow to the brainstem. The brainstem, there are 5 cranial nerves, and if they're functioning, then people are functioning. If they're not functioning, then you can get things like autistic symptoms.
And was he was 7 years old at the time? Is that correct?
Yeah.
How were you able to work with him, Stanley? Was he cooperative, or did you need to, because you had to be able to place your hands on him? Did he have to lie on a massage table and sort of go along with what you were doing?
That's the hard part. Doing what I do is the easy part. And each kid is different. Because if you start to work at the back of the head, the skin at the base of the skull, they don't like it. They take their hand up and try to move it away, and you kind of have to coax them and get their acceptance and make them feel safe. When you can do that, then I can do the hands-on technique. I'll tell you what that is. But it was nice. He was cooperative, and then we made the change.
Excuse me. So I can hear people watching this and thinking, 1, that's not possible. 2, well, he never had autism to begin with. So nothing, something else went away, but it wasn't autism, because you can't cure autism. But you're his mother. You saw him for years and saw the change. So in your mind, there's no doubt that he fit the diagnosis for autism.
Totally.
And then he didn't.
Yeah.
So you brought him back a few more times then?
I think after 3 months or something, we just went for a checkup with Stanley. And then actually after 2 years, he had a little big a back fall, and he said, Mom, one Sunday, he said, Mom, I think I need to go and see Stanley again, because he could really feel the difference. He even said when we came home that it was very weird what we did that day, because we had been doing many things and it was painful, but the fog is gone was his direct words.
So were you able to speak with him more about what it had been like for him?
Yeah, we spoke a lot. We are still speaking a lot, because he's very well aware how lucky he is. He's very well aware.
My immediate reaction is he needs to write a book. But for kids maybe, right? Because he's just turning 12, I think you said. Exactly. Right? So it's been 5 years since he came out of his fog, and since that time he's led a would you say a completely normal life?
Totally. Yeah, he's doing karate, he's doing badminton, he's having friends, he's having friends to sleep over, he's going out to friends, and he would never do anything before that. Before that, he didn't have gymnastics in school, he didn't have religion, because he couldn't understand the concept of religion. He didn't have art, because he didn't like to get dirty. I think the only subjects he actually had was math and Danish, because all other subjects in school, if it was out of understandable reach, he couldn't have it, or if it was moving the body, he couldn't have it. If it was getting dirty, he couldn't have it.
He just couldn't tolerate those sensations.
Exactly.
Yeah, okay.
So we had a very tolerant school who said, we just need to teach him basics, and if he needs to be an art teacher or he has to be an artist, he will be later in life, but he doesn't need to learn this in life now. So it was a very, very good cooperation with the school.
And his academic understanding that just picked up after he sort of emerged again, and so he caught up, I imagine, quite quickly. Exactly. Is that okay?
He couldn't read. He couldn't read until the 3rd grade, And after this, he could read. Everything changed after this. He had a normal language, he could read, he started doing his homework, he got interested in life, in school, in everything. Yeah.
So, Stanley, a couple of questions for you. More than a couple, I'm sure, but what causes the nerves then to get, what, I don't even know how to refer to it, blocked?
Yeah.
Is that a...
The blood flow to the nerve gets blocked, and so it ceases to function as it should.
And is that due to an emotional occurrence, to a physical trauma?
I would say physical. And we don't know if there's a specific trauma. Going through the birth canal is traumatic for a lot of people. So it doesn't have to be anything that a trauma therapist would say, that's a trauma. It's just the head gets twisted and pushed, and usually it comes back sort of okay. But sometimes it doesn't.
Right,
and when
okay.
it doesn't, there's a physical pressure on the blood vessels to these 5 nerves. And so what I was able to do, and I'll tell you how I did it, I was able to release the tension, physical tension, in the joint between the neck and the head. And then that allowed the blood flow to continue or come in. Yeah.
Wow. It's still finding myself a little speechless. I imagine other people would be as well. Yeah. Now, I would imagine that this is not necessarily the sole underlying cause for the autism diagnosis that every child has, right? So this might be, for some children, this might be a huge thing, like it clearly was for your child.
Yeah.
But other children might have other things going on, because autism tends to be a very complex whole body sort of thing.
Yeah.
But for your perspective, you got your child back, and he's back, and now you know what you need to do, and he knows what he needs to do, and he's aware enough of how he feels that he can tell if something's not quite right anymore, right?
Yeah.
Which is what a huge gift.
Exactly. Yeah.
My goodness.
Yeah.
Now, did you, I just have to ask now, have you gone in for treatments too? Just to see if Stanley can.
Me?
Yeah, I was just wondering if you decided that, you know, maybe you'd get one too, to see what he might break loose.
Actually, I think I'm the only one who didn't, but he treated the rest of the family.
Oh, really? Oh, no, you have to go back yourself, right? That's a typical mom thing, right? To help everybody else, but not yourself.
But, I actually started to study Manovision, which Stanley knows.
Yes.
Yeah, and they learned a lot from you, I guess.
I hope so.
Yeah.
Yeah, wow.
So I went on that road, because I saw the difference that Stanley did to my child.
Yeah, well, it's a remarkable story, and it just again is a bit overwhelmed by the huge difference, and it's wonderful, and I'm sure everyone watching is hugely happy for you, and also wondering how they can take advantage of this for their own child to get as many benefits as they can from this. So I don't know if you want to stay with us, Piia, for the rest of the conversation with Stanley, or if you'd like to say farewell. I leave it up to you if you'd like to hop in again.
I would like
okay,
to
sure, that's fine then. Then hang out with us. So Stanley, is this something? And obviously, I know you can't predict that. Again, this is going to solve everyone's troubles. But tell us more about what you've seen over the years of treating children and adults using this, because this is cranial sacral therapy, but it also sounds like you've developed a really particular set of techniques over the years that aren't what perhaps a typically trained craniosacral therapist would learn, right? So this is kind of your own method, so to speak. What have you discovered that you know that we need to spread the word about a whole lot more globally?
I have success with almost all of the kids that I treat. And it usually in the first couple of sessions, if not the first session.
And when you say success, what do you mean by that?
A little bit like we heard, the kid will become social in his behavior. His language will get better. You can take the list. His being aggressive disappears. His being depressed disappears. And he becomes normal.
And this is based on seriously like 20 minutes of
I like to do it
hands-on exercises.
Yeah, I like to do it in 20 minutes when I can.
Okay.
I get a little disappointed if I have to stretch to a second or third session.
Okay, so you're really seeing really remarkable achievements here.
Yeah.
So what have you discovered that about what are you doing that's different? Yeah.
Okay, I'm using a model, a theory about the way the nervous system works. And we have a part of the nervous system which is called the autonomic nervous system. Unfortunately, that's been totally misunderstood and is not useful the way it is. But Stephen Porges discovered the polyvagal theory, and he theorized that we have to have 5 nerves to work in order to be social. And most of the symptoms you see with autistic kids are the fact that they're not social, like not having language is not being social, not making eye contact is not social. And so my training in craniosacral, I said, well, how can I get these nerves to work? So I went into my experience with craniosacral, and I found if I can loosen the connective tissue, which is just under the skin at the back of the head, often these nerves start to work. I don't know how or why, but I postulated it must be that there's blood flow coming into the brainstem. And when that happens, then all the wonderful things happen.
And again, just to back up a little, so the polyvagal theory as set forth by Stephen Porges is that instead of there being just the sort of the binary states of the autonomic nervous system, the sympathetic and the parasympathetic, which was sort of always the fight or flight, or other way around, the rest and recover, the fight or flight, that there's a third aspect, which is the social engagement aspect. And so this is where you see things like monotone voices, right? Exactly. So there's a lack of prosody in people's voices and a blank affect. And of course it gets way more complicated than that. And I know your book goes into great detail about
You've got a pretty good
3 branches. Okay. Okay. And that it's this third branch that is often so out of whack. But I think this has huge implications, not just for kids with autism, but for a lot of our kids who are have suffered early developmental trauma and are stuck also like in either a freeze or a fight or flight state. Because a lot of our kids also are hyper vigilant. They're always looking for danger. They're just they're wired for aggression as sort of at the drop of a hat. And so your technique is also successful at helping these children as well?
That's the main thing. And the nerve that is necessary, one of the 5 nerves, is the ventral branch of the vagus nerve. Now, people talked about the vagus nerve, but they didn't separate the ventral from the dorsal. And this,
Ventral meaning the front, dorsal being the back, or is that right? Did I have that backwards?
yeah, it's that's not so important to me.
Okay.
I'm not so good with that. But if the ventral, there are two branches, and if we knew in Roman times what we know now, we wouldn't call the two branches parts of the vagus nerve. We would just say this is nerve A and this is nerve B. But because we put them both in this box of vagus nerve, we can't separate them in our thinking. And if we can't separate them, we don't know which one is helpful and which one is not helpful.
Now, is the exercise that you're talking about that you sort of developed, the one that you describe in your book as the basic exercise?
Yeah.
Okay. I think we can't wait any longer, Stanley. I think we got to talk about what this exercise is, because it's frankly, it's kind of unbelievably simple.
Yes.
And hard to imagine that it could have such a profound effect.
Yes.
But can you kind of walk us through this? Because you've got pictures in the book, and, you know, along with a narrative description. But I think it's always helpful to see like a real life, you know, a real life demonstration.
Okay, so what I do is I get the person to fold their hands together and put it behind their head. Put their hands behind their head. You want your hands up a little higher.
Okay.
At the back of the head, not on the neck. And then you take your eyes and you just look to the right with your eyes, and you hold them there. And after a while, I see where we can help you. After a while, there will come a sigh or a swallow.
Can I talk while I'm doing this, or better not to?
I think it's better not to. So there you go. Was that a sigh or a swallow?
Yeah, I can sort of feel that now.
Okay, and then you take your eyes and you look to the other
To
side.
the other side.
And you hold them there. There you go.
Okay.
Okay.
Now, that took me, what, maybe 15 seconds on each side? Maybe? I wasn't counting.
Yeah.
Maybe less.
Yeah.
Now, I did feel a little something in each direction. Not a huge something. But now, Piia, I know you've muted yourself now, but you said that Wilhelm actually said it hurt a little when it released for him.
Yeah.
But I imagine, was that like just a quick, I don't even know how to describe it.
No, it was, what was painful for him was when Stanley was doing the cranailsacral therapy in the neck.
Okay, so it just was so tight. Is that what was going on for him then, Stanley? That it was just the tension caused some discomfort. Okay, thank you. So what I find not painful, but slightly uncomfortable is holding my eyes in either direction.
Sure.
That's a sort of a strain. Now, does that indicate that I've got stuff I need to let go of?
You already have let go of it.
Uh-huh. Because I could see...
You're smiling very easily now and very naturally.
Okay. So you can tell a difference.
Yeah.
Do you notice this as well, Piia? I don't know. I mean, you're not trained in this, so I don't want to put you on the spot, but like, I'm not sure I could notice it, which I find so interesting.
Yeah.
How do you get oppositional or uncommunicative children to do this?
This is an issue. Depends how they are. I might have the mother stand off to the right and have them look at the mother. And I might use my hands at the back of their head.
Instead of having them do it.
Yeah.
So you're kind of judging whether the kids would prefer to be kind of in control of this themselves or whether they need a little help.
Yeah, there are options.
But either way, the effect is the same. Although I imagine, you know, there is something about somebody else's touch,
Yeah, but
you know, on your body, but that's not necessary.
I look at it that there's some nerves at the back of the head that go up and around. It's called the greater occipital nerve, and it just goes up that way. And if you put your fingers on that, and then you use your eyes to the right or left, then the occipital nerve also goes to the nerves that take the eyes looking left and looking right.
So once this has been released, is that the right word to use?
Yep, yep.
So there's more blood flow.
Yeah.
Again, are you noticing like instant improvements in your office with these children?
Yeah.
And can you describe some of those changes?
Well, it would be that I hear it on their voice a lot, and I see it in their eye movements, and their face relaxes and becomes much more expressive, because the nerves that go to the face are the 5th and 7th cranial nerves. And as soon as they get better blood flow, then the muscles work. And they'll make eye contact with me. They'll do all the things that parents try for years to get them to do. And it happens like that.
How long does the effect of this one exercise last? And I imagine it varies, but
varies quite a bit, yeah.
What, I mean, with these kids who have been in different states of hyper or hypo arousal, or just have kind of disappeared behind a fog.
Yeah.
Is this something they would do multiple times a day for a while, or once a day, or, I mean, what, just give us some kind of guidelines here, what you've been seeing.
Say once a day, maybe 4 or 5 times. And then if the blood flow is there and the symptoms are gone, the kid is behaving socially and making eye contact, there's a prosody in the voice, all of these things, when they happen, then the kid is good. But if in a week it starts to disappear, then he should get treated again.
I'm still yawning.
Yes.
Do you find that happens? Because I mean, I know for myself, I yawn when I'm releasing stress from my body.
Yeah. And I see your smile.
And I promise I'm not tired. So it's not that I'm bored with our conversation, right? So, okay.
But your smile is very spontaneous, and you're laughing, and you're having a good time. That for me is a sign that your ventral vagus and the other 4 nerves are working perfectly.
But as I recall from your book, it's also relatively easy for it to get knocked offline again, right?
Yeah.
So were you not describing sort of going through an exercise where you just thought something, a sad thought, and then realized that it was, you know, boom. Now the change in, I don't know how to describe it. So more people with, who have been living a more neurotypical life, it's not as, what's the word I'm looking, it's not as extreme a difference, right?
It's when you are in your ventral vagus, when you are in the 5 cranial nerves that have to do with social engagement. Are you with me? I'm losing my visual with you. There we go. Okay.
There we go. Yep, you're back now. Okay.
Okay. When this whole set is working, set of nerves, then you're good. you can be thrown off balance, and you will be thrown off balance some of the time. So if you have problems with a neighbor, you're not going to feel happy. You're not going to feel at peace. Stephen Porges said, if there's no ventral vagus, there's no possibility for love. There's no possibility for happiness. That's pretty heavy. And so if you are in a situation where you're being attacked, or you're with someone who is not able to feel love, then you're going to tighten up and defend yourself. That's okay. Because the important thing is you can adapt to being loved and feeling loving and trusting. Love and trust are the two key words. If you feel these things are possible, then it's easy to be socially engaged. But if you're in a situation where you don't feel these things, then your nervous system should respond by fight or flight or withdrawal. It's just survival. But as soon as the threat or danger is gone, then you should be able to come back home and loving and trusting and all of that good stuff.
Oh, that good stuff. How much training are you doing with this now? The book came out, so now really this is available to anyone.
Yeah.
You can order it from, Amazon or Barnes and Noble or wherever you want to buy your book. Have you heard from people who bought the book, who have tried this, who aren't your clients?
Yes. And I get great responses. Most of them are adults, and most of them are talking about their own situation. But I get letters that are just amazing. It changes their lives. Turns on a dime.
And I think you mentioned when we were talking earlier, maybe in an email, that you are starting to do some training around the world now, right? So,
well, yeah, but not very much. I'm going to give a course in California, in Los Angeles, and I'll be giving a course in North Carolina. But I've cut way down on my teaching. I'm getting
Stanley,
older.
you can't do that. You can't do that right now. Sorry.
I know.
Now you have, I don't know what an assistant. You've been training somebody at your clinic, right?
Yeah.
In
I would say
Denmark.
Thor has become the person I think will be able to carry the torch.
Okay.
And we just taught together in India at a university in the Department of Osteopathy. So I will teach with Tor, and I'll, as much as I can, turn the teaching over to him.
Because
I wish
obviously,
it was 10 years ago, but it's not. And I'm a little tired. I'm getting a little older. And I've got some health issues that I have to take care of. So when I wrote the book, I was really going to run around the world and teach seminars. Now it's like, okay, I'll teach in July. It's a whole different life for me.
okay. Are there other exercises beyond the basic exercise that would be useful for people to know that help with other things?
Yeah.
And
you're already doing better, because when I saw you before, you had some tension in these muscles on the one side. And I could see the muscle on the one side.
Okay, interesting.
That's enough to take you out of social engagement. And so I have an exercise in the book, but you're fine with that. The exercise is you grab it, and then you twist it, and is it more
now,
tight?
Which muscle are we talking about? Right here?
Right there. Yeah, there you go.
And
your left side is better than your right side. So if you twist,
I should do it over here.
Yeah, do you feel it's a little more uncomfortable there?
And just twist?
Twist one way and then the other way. And
Oops,
one side.
We've got a visitor here. All right. And then am I waiting? Am I waiting for something? Sorry, I had to kind of.
That's okay.
Am I waiting for a similar kind of release?
Yeah, and if you want to really get benefit out of it, what you do is you take your foot down in the ankle, and you take your toes up on the foot while you're holding that left side.
Say that again.
You're holding the left side with the twist. Then you take your left foot down and your toes up on the left side.
So the opposite neck to...
No.
Same. Okay,
Yeah,
now I'm getting myself confused.
Just
okay.
about released, you have to come back. And so the movement is foot down, toes up. How I got to these places is crazy, but they work. So when I look now, I don't see as much tension in your muscles here. You look much smoother.
Well,
and you might notice you can turn your head easier to the side.
Okay, so that's another thing to check. Now, you also have exercises in the book for how to help migraine headaches, which is another huge issue for millions of people.
Yeah.
And that's super helpful. You also described two other things that I thought we might just touch on because I found them really remarkable. One of which I think we chatted about really briefly when we talked a couple years ago, but I think it was after the official interview ended, which is about how easily the C1 vertebrae, the very top of our spine, can get out of alignment.
Yeah.
And that's obviously another huge issue in terms of blood flow to the brainstem, right? Yeah. With that out of whack.
And that's the reason that the vertebrae turns and reduces the blood flow. Because
I'm sorry, what's the reason?
To cut down the blood flow to the brain. That's useful. It's useful if I have to fight. I don't want to be thinking, oh, I have a shirt like that guy's shirt.
Oh, okay. I see what you're saying.
You just want to you want to fight or you want to run.
So when we're in fight or flight all the time, you would expect to find that that's out of whack because the body's constantly diverting the blood flow to the extremities and muscles and away from your digestion and all that good stuff. And I think you had said, and I think you say in the book that again, just a difficult thought can cause it to kind of go out of whack, which I think threw me off because I remember going to see a sort of specialized chiropractic person and having literally an x-ray done of my child's C1 vertebrae and being horrified at its placement, or it looked completely out of alignment. But what you're saying is that that's not surprising at all, and that in fact to get it back into place isn't necessarily that difficult either. That it's in and out a lot, right? It's a much more
and that's a good thing for our survival.
Is the exercise that you described that we went through, does that also help realign the C1 vertebrae? Just like that?
Yeah.
Okay. All right. Now here's another thing that you describe in this book that also I have personal experience with, which is plagiocephaly, or flattening of the skull.
Yeah.
And in my child's case, it was, I believe, due to the fact that she was born with a little torticollis, so her neck was already like, which you probably have a lot of experience with too. Part of her neck muscles were sort of tightened and shortened. And so already her head was tilted and she spent too much time on her back. Yeah. So her head was flattened in one area fairly significantly, but we went through months of wearing a cranial cap. And different physical therapy to try to help her be able to turn her head more freely. But you're describing actually completely a way to get the skull or the brain to fill in the skull and to reshape the skull without use of a cranial cap or any sort of physical thing. And how the heck is that possible?
Well, if you look at these two muscles here that we worked on before, if the one is tight, it's going to do this. And so what I do is I force my head back on line, but the muscle that goes here will in time deform the head. So when I look at my kids who come who've got autism or any of the spectrum disorders, they're always flat on one side of the head at the back. That flatness is there because this muscle tension is chronic and it's just pulling and pulling and pulling. So as we get this muscle relaxed, which you did, you grabbed it and then you twisted it and then you worked with your foot, you took your foot down and your toes up. That relaxes that muscle, rounds the back of the head, makes it easier to turn the head. So it does all these things.
Okay, I'm just sort of blown away again. I mean, it's really just remarkable, and that it should be so completely simple is, I don't even know what the word is. I mean, it's a wonderful thing, but it almost feels like there's got to be more to it than that. Like, how could it possibly be so simple? Yeah. That it's just a slight kind of muscular, neuromuscular tweak that could open up so much potential so quickly. It's just kind of astonishing. Now, you also, and this is kind of beyond the scope of this discussion, sort of like the migraines, but I wanted to mention that. So if any of parents out there have migraine headaches, there's some diagrams in here about how to figure out which type you have and how to correct that. But there's also some information here about just posture and how to get yourself straightened back up and realigned so that you're, which I would imagine for a lot of people, especially folks who spend a lot of time at their desks, hunched over.
Exactly.
It would be really, really useful to learn as well. So this isn't just for your kids, I guess is what I'm saying. There's a lot in here that I think parents could benefit from, or just anyone who's suffering from a lot of these issues.
One of my friends,
No, go ahead.
Who's a very popular teacher, a guy named Tom Myers, he talks about space medicine. The relationship of one thing to another allows health or causes problems. So what I've been working with for the last several years is the breathing. And I find when people start out, they have very restricted breathing. When you have a restrictive breathing, what happens to the heart? There's no room for it. What happens to the lungs? There's no room for them to move. So for me, it's not surprising that heart disease and cancer, which has been, there are at least 2 Nobel Prize winners who said that cancer could be coming from a lack of oxygen. Okay, and then you got the heart being squeezed. And then the third most common cause of death is breathing problems, COPD. And what if we look at what's happening to the chest, the room there, it gets smaller and smaller every year naturally. But if it takes a hit, it gets very small, then people are open to these different kinds of problems. So it goes well beyond in my world, it goes well beyond migraines, and it goes well beyond autism. It's really, can I open my chest? The old days, people used to say, can I open my heart? But can we open the chest physically and increase the movement here? And I have had some kids where my usual treatment with the usual sequence hasn't worked. So I went in and I worked on opening their breathing. The autism disappeared. So it can come from many, many things. What I put in the book is the most common denominator, but it's, if there's a problem in the body, whatever it is, the person is not going to feel safe within themselves. And then they're going to be having a hard time staying ventral vagus.
Again, so that's the social engagement part. So
to be socially engaged, we have to feel healthy. We have to feel healthy. It's not that I go to the doctor and he says, I'm not sick. I have to feel healthy.
Yeah, can you talk a little bit more about this concept of feeling safe in our bodies? You know, a lot of our kids, especially those with early trauma, you know, they may have suffered, there may have been in utero stress, so they're getting bathed in stress hormones from their mother, or maybe there was a difficult birth, or maybe there was abuse or neglect, or, you know, again, an attachment disruption, all these different things that kids have gone through.
Sure.
But how does that, and then we know a whole lot about then, you know, their amygdala gets triggered, you know, neurons are starting to form connections in certain ways so that, again, they tend to have just a life perspective that the world is not safe. But how do you see that linked to how their body feels? Because it sounds like what you're saying is a lot of their external perspective on life comes from just how they're feeling internally.
Exactly, yeah.
And are the heart and chest and lung opening exercises, I don't remember about that actually. Are those also in the book? Those are some of the posture things, or those are different? Okay.
Yeah. That's where I want to go. I would love to do that book.
Yeah.
I'll show you one or two things you can do which will open your breathing immediately.
Let's do it.
Okay. So if you just notice the way you're breathing through your nose, then you take your finger around the nostril and you twist the nostril one way and you twist it back the other way. Which direction is there more resistance?
Up.
Yeah, so go into the resistance. And then you don't do anything. You wait for the sigh or the swallow. You wait for the release.
Okay.
It happened?
I think so.
Okay. How is your breathing now?
It's hard for me to tell. I mean, it's clear. I didn't notice that it was restricted earlier. So
okay. Let's say that it's clear on your left side.
Okay.
Let's take the right side.
Okay. And again,
twist it. Tweak it the one way and tweak it the other way.
This one I don't notice nearly as much difference, but still.
There you go. A little bit more to that side.
Yeah.
Then you just wait for the release, the sigh or the swallow. Yeah. Okay. And now how is your breathing?
I think I noticed that now.
Yeah. Yeah. So there are many things we can do to open the breathing. That gives you a deep breath. People are always telling you, Alison, take a deep breath. They never tell you how. Here, you now know if you want to take a deep breath, you twist it and you wait. And then when you notice again, the breathing will be deeper.
Wow. Okay. Great. Thank you. That's another, just a little freebie there for.
Yeah.
Whoops.
Okay.
The training that you're doing out in California,
Yeah.
I assume you're training, are you training craniosacral therapists?
Or therapists. A lot of them will be trauma therapists. Basically people who work with other people rather than people who want it for themselves.
And how can people find out more about that if they work out there, if they would want to go out to be a part of that? Or would you be able to share that information with me and I could then post a link or something where people could find out? Is that's going to be in the summertime, did you say?
Yeah, yeah.
Okay, so a few months away.
The woman I'm working with Tor and a woman named Judith. And she's been doing trauma therapy and working with the relationship of the body to the emotions for years and years. So the three of us are going to teach there. And she's doing the arrangements, and her name is Judith Johnson. And I will get you the invitation to the course, and that's got the information in it.
Okay. And then I'm going to separately work with you. You don't know this yet, to see if we can convince you to do a little bit more elsewhere or do an online training. You know, because how much of this do people need to feel with their hands versus understand the concepts?
Understand the concept and then work with their hands or their body. But it's a little bit easier if you're a bunch of people and somebody's, I feel much better, and then everybody gets hysterical and feels better.
Okay.
But we spend a lot of time looking to see how it will be when the person is better. What are the signs? So it's not just somebody saying, well, I feel much better. I did this technique. I feel better. I want to see, is the breathing better? Is the facial expression better? Is the movement of the head and neck better? Then I have some guidelines.
Well, and if talking about these kids, right, just as Piia saw, then, you know, then is the communication better? Is the behavior better? Is the emotional expression better? You know, and those are things that are, would be immediately obvious to any parent who's been living with their kid on a day-to-day basis and experiencing a lot of really, really challenging stuff.
Yeah.
So I'm looking at our time, and I think we probably need to be wrapping this up. So again, I just want to recommend that people go out, grab the book, recommend it to their library, so that we can get this information spread around a whole lot more widely, more broadly. Give the exercises a try on yourself. Try them out on your kids. Do you have any final tips for us on kids who say, you know, I don't want to do that stupid exercise. You know, you can't make me. I'm guessing it might help if it's not always the parent asking the child to do it. Yeah. So that's one benefit with working with somebody else on this. So you think, could people take the book in maybe to a chiropractor or a craniosacral therapist they're already working with and just, you know, see if they'll do it with their child instead? Is that a good...
This way. Some people are very happy. Some people are offended that you're telling them what they should do, but, you know, we're just people.
Right. Well, obviously you'd need to work that out with your practitioner, whether they would be open to trying something like this, but hopefully many would be. I'm just thinking of ways, because again, I know that it can, you know, the oppositional relationship that's been in place with a lot of kids and their parents for years can be difficult to overcome.
Absolutely. It's very difficult for a parent to feel safe with their child's behavior. And
well, there's that as well, yeah.
If the behavior looks like it's getting better, do they trust it? So I work with a woman in New Jersey, which is close to where I come from. and we would work together on autistic kids. She would do her stuff, I'd do my stuff. And she says, Stanley, I will never work with an autistic kid if I can't work with their parent. And the next person that came in, I looked at this parent and I said, God, if that was my prime caregiver and I had to fit my life into the way that person is emotionally, I'd be really screwed up. So,
well, and yeah, I think, you know, there's always that chicken and the egg issue, right? Because of course, there's a lot of parents who say, well, everything was fine until my kids started acting out in a certain way, and now I'm a total wreck. And I probably put myself more or less in that, although I know, of course, that our children bring out issues that we need to work on ourselves anyway. So they're here to teach us, and we're here to learn from them. And so there's definitely that. And I also know that I never in my life was as stressed as I have been the last, 10 years.
Sure.
And almost entirely, and Pia's laughing, right? Because she knows that's right. There was before, and then there was, after all those issues, and now you've sort of gotten your life back too, I imagine, right? You've got a more easygoing, easy to live with human being in your home, and that of course affects the emotional. Yeah. So it makes perfect sense, I think, for the parents to also be trying to do this exercise themselves, or, take care of themselves as well, so that you're both in a new emotional space. Exactly. For each other. Yeah. Well, I cannot thank you enough. Piia, thank you so much for joining us and sharing your story. I appreciate that. Stanley, thank you for being you and doing this work and putting all these pieces together and writing the book. And again, we'll chat about how we can try to maybe expand your reach.
That would be wonderful.
Yeah, and so we can get this word out more broadly. So thank you both for joining us from Denmark. I appreciate that. Thank you, everyone, for joining us for this interview, and we'll see you again soon.